Shaw from Las Vegas, Nevada here, Optimal Health members. Today we're going to talk about something we commonly see here, and that is called frozen shoulder, otherwise known as adhesive capsulitis. Okay, now how does frozen shoulder happen? A number of reasons. It's very common in people over their 40s, specifically female, during menopause, when the hormones start changing. It could also be from inflammation, if you have an inflamed rotator cuff or bursitis, or if you've had a previous injury before and you never really thought much of it because you had some movement and then gradually one day you woke up and you just can't move it. Well, let me tell you, that happened to me. I had not just one shoulder frozen, but both of them. Now you're probably going to ask yourself, how the heck did Dr. Colgin have both of his shoulders frozen as a chiropractor? It happened slowly with one, and then out of the blue, next thing I know, over a period of time, and it was quick, like within a month, one shoulder went down where I could barely even get my elbow, past my shoulder to this point, or let alone raise my hand forward this way without excruciating pain. When I went in for a swim one day, this happened to be in the summertime, and it was very hard to go like this, like a breaststroke or something like that. It almost got to a point where, boy, I better not go any deeper, I might just drown. Okay, that's how scary it could be if you don't have proper use of your shoulders. And it got to a point where I had to take a week off from seeing patients and actually go see a colleague of mine and also one of my mentors in Davenport, Iowa. He worked on me about a good 3 times a day for 4 days. We had a combination of not only chiropractic care, some laser, and also some myofascial release muscle work 3 times a day for 4 straight days. I have never had that much physical work done on me ever. But I'll tell you what, they got my shoulders moving again. I'm functional. I can reach my hands above my head. I can grab things, and I'm so grateful for what that doctor did for me. And that doctor's name was Dr. Mitch Malley in Davenport, Iowa. Love you, Dr. Mitch. What we do and help people here is very similar. We use an embrace technology here called soft wave tissue regeneration technology, and we also do some resistive range of motion exercises with the patient so we can kind of start unlocking these adhesions, otherwise known as scar tissue, to get that shoulder moving again. It does take a little time. It can be a little bit uncomfortable, but the results are always very rewarding. What we look at here is, let's just say, especially in the world of type 2 diabetes, people with type 2 diabetes, this is happening way too much because of that lack of blood flow, or what we call vasodilation. They now have vasoconstriction. They're not getting, their blood flow is not, the blood's not moving as much as it should to help with circulation with the shoulder and also down in the feet and ankles or to the wrists and hands. So these can cause a lot of problems over time, which create an inflammatory cascade, causing a lack of motion and also just a lack of viability. This is the shoulder joint. This is the front. This is your clavicle here, which is right here that goes to the sternum. And then over time, you just can't move the thing. They're very subtle movements. It's hard to move. You can't do this, you can't do that, and it's very painful. And it gets to a point where, a lot of people, in my experience, they just don't even want to deal with it anymore. Unfortunately, though, over time, they're also more apt to injuring themselves even more if these joints aren't moving the way they are. Remember, we got these things to move. The old saying goes, if you don't use it, you lose it. Well, in frozen shoulder, that's definitely the case. You haven't been reaching above your head often. Everything is so convenient for us now because it's all within, a hand's distance. But we're not doing things like we were as kids, like swinging your arms back and forth, like we used to do, or reach above our heads, or just exert ourselves a little bit, or even use some kind of resistive exercise, especially when we're working out in the gym. These are all things that can help prevent these shoulder injuries, or what we call chronic things, from happening over time. And this is usually what we call cumulative trauma. It didn't happen overnight, but it just from the cumulative trauma that your body went through, you just were never really taking care of it like you should have. There is help, there is hope. A lot of ways in the world of medicine, how they help with the frozen shoulder is they'll use steroids or NSAIDs, non-steroidal anti-inflammatories. I like to be really hands-on. I want to get your motion and function back. I want you to see improvement. The exercises are very simple to do at home. You don't even have to go to the gym. It's just about being consistent and doing things on a regular basis. And even myself, I'll do things every now and then where I'm in the room by myself and I'm just going to swing my arms like this just to make sure I can do it, right? Wow, I can actually do this, doesn't hurt, or do this and that doesn't hurt. And believe me, it hurt when this first happened to me 6 years ago. I'm never going to go back to that step again. Okay, so it's always good. Use your limbs. Do a self-audit every now and then. Just reach above your head just to see how it is. And if you're having any problems with that, have someone help you. Go see someone like ourselves here, like as a chiropractor or a physical therapist, or someone you feel comfortable with. We've been very successful with everything we do here because we embrace technology, we leverage it, and we also want to make sure that you get healthier and get your range of motion back and get out of pain faster. Otherwise, it's going to take a lot longer than typical. That's frozen shoulder. A lot of reasons for it. It can happen just about anybody. Usually it's someone in their 40s or older, or someone who's had maybe a heart attack or stroke, where they've lost the innervation from their brain to their shoulder so they can't move it anymore, or it's in a locked up state, and then it eventually come back, but the rehab on that is very hard and very difficult. Do your best, take care of yourself. If there's anything we can do, kind of assessment, examination, please come on in. Come in for our new patient special, which is $48. We'll do a thermography scan to see if there's any inflammation in there. We'll do some range of motion, and we'll actually do your first treatment using our soft wave tissue regeneration technology to give you a good idea of what kind of help you need moving forward to get that shoulder range of motion back to where you want it. Thank you very much for being here again with us today. We look forward to being serviced, and just remember, the body always wants to heal. Mahalo.